So part of the back that a lot of people forget they have is in the pelvis where the sacrum is wedged between your pelvic bones, called the iliac bones. And this joint here is a weight-bearing joint called the SI joint. If you could imagine a keystone in an arch, at the top of the arch, that upside-down triangle stone is much like our sacrum, where all the body weight comes down on it and then rests on these two joints here. These joints will commonly get irritated for people who have one leg that's shorter than the other, or if their pelvis doesn't move smoothly, then the ligament on top of this joint will become irritated or even torn. And that's called SI joint arthritis. There are two different ways that we deal with this type of arthritis. One is sometimes we're asked by surgeons and orthopedic doctors to inject steroid into the joint. And we can do that under x-ray. It usually only takes about 15 seconds aside with a very tiny needle. If we're not sure if the joint is what's causing it and we want to find out quickly, we can actually put in about a half a teaspoon of numbing medicine just on the outside of the joint and wait an hour and then have people do things that would normally hurt in that location. If their pain goes away, or if most of their pain goes away, then we know a significant part of their pain is coming from this joint. In that particular instance, where we find that that is the case, we can go back with the special radiofrequency needles and heat the surface of this ligament, and that turns off the nerves for about 8 to 12 months at a time, during which time we encourage patients to work on their core strength, their tummy muscle strength, and make it to where their pelvis is a little bit more level and moves more smoothly. And that involves physical therapy and a home exercise program. This is very common in America because about 80% of us carry extra weight. And with that extra weight, our tummy pulls the pelvis forward. And when it does that, this is an unnatural angle on this particular joint. So working on tummy muscle strength over time to bring the pelvis back up to level again has been a very successful strategy for helping people not have to have the procedure repeated.